Shoulder pain is a common problem amongst the amateur athlete population, especially if you're an athlete who plays an overhead sport or if you play a contact sport. This can be super frustrating, especially if you take time off in the off season for your shoulder to heal and then things seem to settle only for it to come right back again as soon as you get back into the competitive season. In this video today, I'm going to explain why your shoulder is causing you recurrent problems and how to overcome these problems for good. Shoulder pain amongst athletes, whether it's amateur or pro, is super common. Whenever training away from the competitive nature of sport, there's always things that have to be worked around, and shoulders are one of those things that are more often than not going to have to be worked around. It's often a fight just to be able to manage your shoulder pain and get out on the park every week. However, even though this is a frustrating process, it doesn't necessarily mean that your shoulder is damaged or broken, or that it's because you have bad technique. Your shoulder has to handle a lot of repetitive upper body loading, especially if you're someone who's playing an overhead sport, and especially if you're someone who plays a contact sport where you're taking contact on the regular in a game. That's a lot of high level repetitive force. And your shoulder can be super sensitive to high volumes, high frequencies, and doing things overhead. But remember, your shoulder can handle a lot of work if you take the time to build that capacity up slowly. Although you have to remember that when you're playing a sport that has a high level of repetitive shoulder loading, you're not going to always be in control of the outcomes, especially if this is a contact sport where you could be taking contact from a 360-degree axis. You just have to make sure that you're controlling the variables that you can. However, the main issue here is when you're getting shoulder pain with training, because this is something we want to avoid. If we can't always control the nature of competition and the shoulder's just feeling sore from playing competitive sports, then we want to be able to control the pain that we're getting in training, whether that's in season, pre-season, or off-season. Generally speaking, with the amateur athlete population, the biggest issue here is that you're going to probably be increasing pressing volume in the gym way too quickly. And when I say pressing volume, I'm talking about like bench pressing, overhead pressing, anything of the nature that is a pushing type action. Especially if you're someone who works a job where a large chunk of the tasks you have to do are overhead, you're just going to be compounding the volume that you're doing. And this is the common problem. There's a really high spike in loading on the shoulder, but that capacity just hasn't caught up to it yet, and then the shoulder gets painful. And the most common problem I see with patients in the clinic who are having shoulder dramas, especially those who are amateur athletes, these are the people who will develop a bit of shoulder pain, they'll back off training by either modifying what they're doing or they'll completely rest. They'll let those symptoms settle down, then they'll return to training, again with no real step-by-step program in terms of how they're going to get back to where they want to be. And that volume just comes up really quickly and then pain comes right back again. And the problem with this recurring process is the fact that you're just not allowing time for your shoulder capacity to come back up appropriately. So I have 4 common reasons why shoulder pain is going to occur with training. So if you're making one or multiple of these mistakes, it's a really good idea to adjust what you're doing so we can overcome this problem. Number 1 is that there's been a sudden increase in training frequency. So if you're someone who is, for example, coming out of a competitive season and moving into that off-season period, and you really feel like you need to put on a little bit of upper body mass for your next competitive season, then this could be something you're making the mistake of. You've probably gone from training upper body, particularly the pressing movements, 1, maybe 2 times per week, and now you're like, all right, well, I need to put on a bit of size. I'm just going to train more, give myself more of a stimulus and more of a chance to grow and get stronger, and then suddenly you're pressing 3, 4, even maybe 5 times per week, and that shoulder starts to get a bit cranky. And that feeds into problem number 2, which is where you're probably layering too much volume in to your training across a range of exercises. And what do I mean by this? If you're going to go into the gym one day and do some bench press, then the next day you're going to do some overhead press, and then maybe on a third day you do some dips, or you've just filtered them across 2 training sessions rather than 3, you might get away with that and you might be okay. However, if you're going to go into the gym and multiple days a week you're going to hit bench press, overhead press, dips, upright rows, lateral raises, and anything of the like, then eventually one or both of your shoulders are probably going to start to let you know they're not super happy with that. And you look at those exercise groupings, and it's not necessarily bad or a problem, and individually each of those exercises are probably fine to train with a decent level of volume and a decent level of intensity. But once you start combining them all together, that overall volume that you've put into your shoulders is going to be quite a lot. Point number 3, this is spikes in overhead loading. And this doesn't necessarily just mean in the gym. If you're someone who plays an overhead sport or your occupation requires a lot of overhead loading, all of these things can contribute to causing your shoulders to flare up when you're training to get better at that sport you're playing. So you could simply be doing more overhead press volume, you could have done more chin-up volume or pull-up volume. You could be an overhead throwing athlete and you've decided that you need to get your throwing either faster or more accurate, and you just start throwing a lot more balls than you have been previously. Or you're a swimmer and you've gone from swimming, say, in a 2K event or a 1500 meter event, and suddenly you decide you want to train for a 10K swim, then that is going to have to require a lot more training volume. And if you jump into that way too quickly, again, that's a lot more overhead volume that you have started putting into your shoulder, and you need to account for that by slowly stepping your way into that extra work. You never want to spike volume, especially if you're going to be doing it for a long period of time. Problem number 4. This is another one that I see amongst athletes in the clinic, okay? Often when we're working through a recurring shoulder issue or a persistent shoulder issue as well, I'm going to have someone doing some level of rehab exercise work, and that's just to slowly build up potential lagging areas or mobilize areas that are a little bit stiff that we need to open up and have move a little bit better. However, if you're doing all of these rehab things, plus at the same time increasing your volume quite considerably in your training, then this could be too much total from both rehab work and training work. You need to make sure that if you are doing exercises from a rehab standpoint, but also you're doing the main thing that you're trying to return to play with or get better at, you can't just step up all of these things at once. We need to gradually build up one thing at a time and just potentially even pull back on the other thing so that we can not overload too quickly and slowly, again, gradually build up into that specific task that we're trying to get better at without spiking the volume. This is important because a failure to adjust is definitely a recipe for recurrent pain. Why does rest not fix your shoulder pain? Here's the thing. When we take loading out of the shoulder, pain will often decrease. It doesn't always happen like that, but often it will. However, the problem here is that tolerance is not going to increase. So when you come back from taking time off and you go back into hitting your shoulders with high volume activities, that pain is just going to come right back again because we haven't increased our tolerance and our capacity to do work. From a rehab standpoint, we need to adjust our mindset here. We need to start thinking along the lines of how much loading can my shoulder currently tolerate, and stop thinking about which exercise is going to fix my shoulder, or which stretch is going to fix my shoulder, or which drill is going to fix my poor shoulder mechanics, because often it's not these things that are the issue. It is the total tolerance and workload and capacity all intertwined that are causing you grief. The way to fix this is by making sure that you adjust your training volume appropriately. And the way to do this is you can either break it down, the easiest way I like to do it anyway, is to break it down across the course of a week and make sure you're tracking it. You need to make sure you're tracking frequency, intensity, and volume. And you can also be looking at the specific exercises that are causing you grief, because they're also an easy way to adjust training volume and intensity when you're just pulling the dials on certain exercises and potentially doing more of these things that are less provocative and less of the things that can be more provocative. And you need to make sure that you're building all of these things gradually over time. We don't want to see this amount of work one week and then this amount of work the next week. We want to see this amount of work, maybe even the same amount of work the next week, depending on your response, or just a little bit more. Your shoulder will respond well to gradual and consistent loading. What are the things that you should be monitoring? You should be monitoring how much something is hurting you during training, how much something is hurting you after training, and how much something is hurting you the next morning. You need to then monitor your trends across the course of a week, okay? And the reason I say do this is because you're not going to adjust your program based off either one good or one bad day of training, because those things can often just be noise. We need to make sure that we're progressing after we've got a whole week of data and then seeing how those weeks of data stack up on top of each other. Because if we take a week and then we feel good after that whole week of work, then we can use that as a green light just to build up a little bit. But you need to make sure that you're tracking this consistently, because if you don't, then you're not really going to be sure if you are objectively able to progress. Remember, it's the cumulative load that matters. It's not just a single exercise thing. If you're an amateur athlete and you're having trouble with recurring or persistent shoulder pain, the tips in this video should help you overcome and get back to where you want to be. However, if you can't seem to get over this hurdle of shoulder pain, it may be because you are actually having trouble getting your rehab exercises right. I do want to stress that you can't just rely on your rehab exercises alone to help fix your shoulder pain. And to help you understand more about that, I have a video just here on why rehab exercises alone are not going to fix your shoulder injuries or pain.